Welcome back to the Woven Well podcast. So, as a part of my job as a certified fertility care practitioner, I'll ask clients about their periods, not just when their last one was, like they may get asked at their OBGYN, but slightly more detailed questions like how many days they last, what the color of the flow is, the volume of blood, so on. So, these details give us helpful information about hormone production, the health of the uterine lining, and sometimes even the potential for implantation. And in those conversations, one thing that will frequently come up are blood clots. So, blood clots during the period. Small, sometimes very large clots of blood that stand out amongst the very smooth flow of menstruation. So, what do these mean? Are they normal, concerning? Do they tell us anything? Well, these are great questions. And one field of healthcare with some theories about it is traditional Chinese medicine. Known for acupuncture and herbal supplements, traditional Chinese medicine has been around for centuries and is still a primary mode of healthcare in many Asian countries. But it's in America too, and it's very popular. Well, our listeners have questions about TCM and about period blood clots too. So I thought I would invite someone in who knows a lot about both of those things to help us answer those questions today. So, Emily Keuntz is an experienced, faith based licensed acupuncturist and Chinese herbalist with 20 years of clinical experience, who received her master's degree from Pacific College of Oriental Medicine in San Diego, and who also trained in the Republic of China. She treats her patients with a whole minded approach, seeing each person as God's unique design. Emily, welcome to the show.
Thank you so much, Caitlin, for having me. It's such an honor to be here.
I'm excited to have you here and have you share. I feel like, honestly, there's so much that we could talk about. So I'm glad we picked one particular topic today. And blood clots are one of those things that come up so frequently. And there's always a question following it. You know, is this normal? Does this mean anything? So let's just jump into it. What do you know about blood clots? Are they normal?
Hey, no, they're not. And they're just so oftentimes overlooked, right? I get my period, I have cramps, and it's never talked about. It's never even asked most of the
Yeah,
time. Do you have clots? What
so
color is your
true.
blood? Just like you were saying before, what's the consistency? It doesn't really get talked about. It gets brushed to the side, but it's really good information that can tell us a lot about a woman's health, her overall health. And I always say to my patients, your monthly period is like your report card. And so clots are not normal. Maybe a few little flakes here and there in the toilet bowl when you go to the bathroom, but clots are an indication that circulation is impaired on some level.
I think a lot of people are curious about what causes them because it feels so mysterious, exactly for the reason that you just said. Like, nobody ever asks about it. And many doctors will just sort of brush it to the side, as you mentioned. So, when we don't have an opportunity to ask follow up questions, it feels very mysterious and overwhelming. And so, yeah, I think let's go ahead and dive in. Like, what are some of the things that could cause women to see blood clots?
So we can talk about the Western side as to why women may experience clots, and then we can now merge over into my world, which is traditional Chinese medicine. From the Western perspective, it's the shedding of the lining. It's very quick, fast, and furious that can cause clots. And also, it may be that a woman has a very, very heavy menstrual flow. And so
Mm,
the blood is coagulating and causing clots. But again, we're going to go a little deeper as to why is that happening, right? And get to the root and then be able to give some advice as to how we can help that. So, from a traditional Chinese medicine perspective, there are 5 reasons why a woman can have clots. We are going to discuss the body in the way that traditional Chinese medicine uses words to describe basically a landscape inside of the body. So, in traditional Chinese medicine or TCM, we look at patterns inside of a body and how those patterns can affect organ systems. So, in TCM, we are all about the movement, the circulation, and the balance of the body
mm,
and communication. But just like a river where there's water that's flowing through the river, we want blood to be flowing through our bodies and circulating through our bodies smoothly and evenly. But when we have blood clots, like I said before, there's usually about 5 reasons why you would have that. And that goes back to our pattern differentiation. And that's why when I treat women, I'm trying to uncover the root as to why it is that they have those clots and look at the big picture holistically of the body. So, not just because this one woman has clots and another woman has clots, are they going to have the same diagnosis, the same herbal formula, the same acupuncture points, because their body is so unique and we
Mm.
need to get to the root and treat it appropriately. So, the first reason in TCM that a woman would have blood clots is what we call blood stagnation. And this is really the most common reason why a woman has blood clots. Usually, the blood is going to be very dark or burgundy, and then the menstrual flow is going to be almost described like stringy or jelly like. It's
Mm.
not very liquefied, and you will have cramping. The second pattern type would be what they call cold, a cold in the uterus. So that means that the circulation, due to environmental factors, again, everything that God created can affect our bodies. We're so tied into this world that He created. So, our environment, maybe it's our work environment. If you work in the OR and there's, AC is cranked up and you're cold all the time, this could lend itself to what we call cold in the uterus. And so, the way that that pattern looks is usually, again, it's going to be clots that are stringy and dark. And then also, you're going to be better if you have heat applied, like a heating pad. You may even feel cold. And also, the blood usually is darker in color than what the blood stagnation pattern looks like. So, it's the blood also that's going to be darker, not just the clots. The third pattern is what we call a deficiency. So oftentimes it's called a chi deficiency. It's whenever the body is not able to really have enough energy to push out the blood. So
Mm.
oftentimes that pattern presents with fatigue and bloating. And most likely it's due to, again, just not having enough energy or cellular communication. And so therefore, the blood is very light, or you may have a very short period. And then there's the chi stagnation. And the chi stagnation is the fourth pattern. And that is usually maybe the period blood looks normal in color, bright red and pretty, has vitality, but you still have some clots. And this is because usually it's an emotional or a physical stress that's
Mm.
causing what we call the chi to stagnate, a chi stagnation pattern. And then the fifth, is what we call heat in the blood. It's going to be a fast and furious period. You're going to have a lot of flow, bright red, and then also bright red clots as well. And that's your heat pattern. So, again, it just helps us as acupuncturists, as herbalists, to identify and to treat you accordingly to your pattern type. And over time, when we are treating you, whether we're using acupuncture and herbs or one or the other, you're going to see that usually within 3 cycles of us treating you consistently, you start to see these patterns start to change and your body become more balanced.
Well, I appreciate you walking us through all those different ones. And it's funny because particular clients were coming to mind as you were describing the different ways that you could see the actual period flow, because I've heard so many of those terms from clients' mouths before. But I also appreciate that it gives us a little bit of an overview, a general understanding of this more Eastern approach versus this Western approach. You talked about how it emphasizes patterns and it looks at the entire person. So, some of the descriptors you were talking about physical things, but emotional, mental, I would assume spiritual is in there too. Like, I really admire the fact that this Eastern approach honors the full individual person and looks at all of those different layers together. Now, some of our listeners may be very, very new to the concept of traditional Chinese medicine and maybe even a little bit hesitant about it. They don't really know much about it. The terminology is so different. I mean, you would never go into a Western medicine doctor and they're talking about heat or chi or these things. It's like, what even is that? Is chi something that I should be nervous about? Like, is this a spiritual thing? Is this something I should be hesitant about? But correct me if I'm wrong, but you're saying that this is just simply a different way to approach the problem. You're looking at the full body, the full person, I should say, and looking at that big picture, and you're seeing changes in patterns in that person's health, which have been labeled for thousands of years under these different terminologies. Is that correct?
It's exactly God's design, right? We are
Mm,
multifaceted beings and we're God's children. And so to just treat the body only physically and not also address the body holistically, where we're emotional beings, we're spiritual beings, we're physical beings. And then if we just only adopt one part of that, we're not able to see the whole picture or to treat the body holistically. And it's not to say that there's any shame of being able to bring in both,
yeah.
right? We can use both in a beautiful way. And I think that that's a big part of this, is that it's not one way or the other, but what about bringing both of them together?
Yeah, I love that. And that's why I specifically wanted to talk about TCM in relationship to blood clotting, because so many of my clients will complain about blood clotting or mention it, ask questions about it. And Western medicine doesn't really have an answer for it, doesn't even really have a category for it. It's most often just said, like, at least this has been in my client experiences. It's what you said earlier. Oh, it's just the blood pooling, or your periods are really heavy, and that's why it happens. But so many women still feel like there's something that's gone unanswered. There's still an issue there. They don't feel at peace about it, and they don't have anywhere else to go. And this is where that Eastern perspective acknowledges those differences, acknowledges not just that she's having blood clots and she's concerned about it, but there are different types of blood clots, and that all of this is communication. It's telling us something about our overall health, and we can listen to that. Now, we're huge fans of getting to the underlying causes, treating those root issues, but because, gosh, we feel so much better and our quality of life is improved. And so, even though the terminology is different and the perspective is a new one, I don't think that there's anything being said here that would be a cause for concern or an issue, even for someone from a Christian faith perspective. Now, there are going to be some who very much disagree with me, but you and I are both believers. We are both Christians. We take this very seriously, incorporating it into our work. And so I just want to put that out there for those who have questions about that. I understand. I do think it matters who you work with. That probably makes a
Absolutely.
huge impact as well. Just like if you were going to a Western medicine physician, who you work with makes a massive difference. So that's important. Getting back to the blood clotting specifically, so it's obviously not a sign of health that that's happening. Are there other health issues that could be associated with it that we may notice outside of the blood clots?
So, from a Western perspective, you may think about if someone has extreme pain with those blood clots,
Mm,
maybe it's time to look into endometriosis with
mhm.
your OB and to do some investigating on that front. Or if your periods are really, really heavy and you're having blood clots, abnormally heavy periods, maybe there is a fibroid, right? So there are times and certain situations when I'm investigating and really talking about the period as to when it is important to also go get some further diagnostic testing done to make sure and to rule out if there is anything else to be concerned about. But on the other side of it, it could be nothing at all other than really
Mm.
just a circulation issue that needs to be corrected.
Yeah, I feel like I may need to look this up, but I feel like I read something once about someone who had fibroids that shrunk with acupuncture support. Is that
Yeah,
accurate?
it is. It is.
Okay.
Usually it's anything under 5 centimeters
Okay.
or less. You'll have a pretty good chance of being able to use Chinese herbal medicine and acupuncture and castor oil packs, all the things to really help circulation, to help shrink that. But again, you
Yeah.
want to go a little further into that. Is it being fed because the estrogen, there's toxic estrogen that also needs to be pulled out through the system appropriately? And that's where that functional medicine and traditional Chinese medicine can really bridge together. And then you can really get to the root and then address it appropriately to where you see changes.
Absolutely. I would normally ask at this point, like, okay, so now once we know what we can do or what's going on, what can we do to improve these blood clots or even eliminate them?
Yeah,
But it sounds like what your answer is going to be is very individualized.
it's very individualized, but I can kind of give some high level
Okay.
things that we can do or do better, right? Little hacks here and there that would help improve. And that is, and this is a big one across the board, no matter what pattern you have, because again, it's all about circulation, whether it's qi stagnation, blood stagnation, heat, all of those create a stagnation pattern. And so, again, we want movement. So, things that we hold very dear are going to be making sure that you don't walk around your house if you have hardwood floors or concrete floors barefoot.
Hmm.
And this even goes even if it's summertime, not just in the wintertime when it's colder outside, but to make sure that you have socks on your feet or you wear house slippers because you have the very first point on the bottom of your foot. And that acupoint is what is going to start the circulation from the ground up to help
Hmm.
again if that channel goes and circles right around the female genitalia. So again, we want to make sure that that female area has good circulation. And from a Western perspective, you have what? The femoral artery, right? And
Hmm.
so, again, we want to make sure that there's not vasoconstriction due to cold feet. And so, again, making sure feet are warm and that you're not walking around barefoot, that's going to help improve your circulation. The other thing I would say is making sure that when you're on your period, that you're eating foods that are rich in iron because when you build that blood up,
Hmm.
it's sufficient enough to be able to move the blood. And therefore, don't be afraid of using heat. If you need heat on your period, use it. It's going to help the circulation. We want to get the clots out.
I really appreciate that even as you were describing the first one about wearing socks or not being barefoot, you gave both the Eastern reasoning and the Western reasoning. It's just helpful for those who are brand new to this to listen to it and say, okay, that's terminology that I know, or I can understand where that's coming from. Because again, the terms are so different that it can feel a little unsettling in the beginning. So I really appreciate you doing that just so we can kind of find that common ground to understand it from this new perspective. So, and Emily, thank you so much for coming on the show and talking a little bit about blood clotting and TCM. I'm definitely going to have you back because I can already think of lots of things that we still need to talk about related to all of it.
I would love that. And thank you so much for inviting me. It's been an honor to be with you. Thank you so much.
You are very welcome. And listeners, Emily has a new program that really combines a lot of the traditional Chinese medicine and functional medicine, provides a ton of education. She and I were talking about it beforehand, so I'm going to make sure to have that linked in the show notes if you're interested in joining that program of hers. As always, thanks for listening as we continue to explore together what it means to be woven well.